Rich, really interesting to hear from professionals inside this industry, from the medical field, who have actually helped people to transition, now saying that it might not be safe. But you've spoken to those who have transitioned, which means they have had their gender reaffirmed or reassigned and then detransitioned.
That's right. So I want to make very clear that, by the way, the rates of detransition for people who express regret in adults is historically very low. The number of young people transitioning these days is kind of seen this massive spike, and so we don't have data yet on the rates of detransition for youth. But I have heard from a lot of people who have detransitioned. I've spoken to people who have successfully transitioned. But now, more and more, every day, we hear from people who are coming forward saying, I have regrets about this, and we're about to hear from one of them right now.
I got my first blocker and testosterone shots at 13 years old, and it was at 15 that I decided that I went under the knife to get my mastectomy.
At this point, you were convinced that this was the right course of action for you?
I was convinced that I was actually a boy, even if I wasn't. Even if my body was female, and nobody really questioned this belief at all.
At 16, she got a double mastectomy, and then she felt something creeping in. Regret.
I told my mom. I kind of just broke down crying to her one night about how this was the biggest mistake of my life. Every single part of my transition was a mistake, and I didn't want to be going down that path anymore.
I mean, 16 sounds young, but I was watching during your reporting, and you said in one graph, adolescents between age 6 and 17, a 6-year-old is considered an adolescent in the U.S., and is that being questioned as being too young for this kind of care?
I don't believe so. I mean, certainly for medical intervention, I think so, yes. But part of gender-affirming care is social transition as well, accepting people where they are and where they say they are. So. Yes, it is not 6 years old is in the conversation.
Is there enough data? I mean, this is relatively new science when you look at the history of medical science, but is there anything that would show that proves hormones, puberty blockers are definitely safe for children?
I know it's unclear is the bottom line answer. I know that NIH, National Institutes of Health, is studying this. They began a massive study in 2015. They tell me, I asked them specifically, and they said the evidence is limited on whether these treatments pose short or long-term health risks for transgender and other gender-diverse adolescents. That was their quote to me recently. So it is really unclear, Adrienne. This is kind of new territory for a lot of people.
Yeah, and again, these stories are being told in a compassionate way, just people speaking out in different ways than we might have heard before about these surgeries and this care. Thank you, Rich McHugh, for the report.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.